Welcome, Earth animals, to Ask Our Vet live from the Ash Creek Annex of the Earth Animal Studios. I am Dr. Kris, your host. I'd like to welcome back any of our loyal viewers who have tuned in before, and I'd like to extend a warm welcome to anybody that's new to the program. For anybody that's new, I'd like to just introduce myself. My name is Dr. Kris Hansen. I am a small animal veterinarian, been practicing small animal medicine for 26 years. I've worked with Dr. Bob Goldstein on integrative medicine for the better part of that, and subsequently came to work at Earth Animal over the last 3 to 4 years, doing product development and just lending a hand where I can. So I thank you, everybody, for tuning in. So today, our program, we do different programs throughout the year. As you know, we'll have special guests. We'll do topic programs. This one happens to be our Ask Our Vet Live, Ask Me Anything. So it's just a forum where you guys can submit questions. We've been lucky enough on these now throughout the last couple of years, and we've been building viewers from really all around the world. And it's become quite a fun forum where we interact, you guys interact within the comments section, and it's really just an open dialogue. It's one of my favorite shows to do. So I hope you enjoy it. Please, just a couple of housekeeping things. If you like the show, please do like it, and please share with friends. The more the merrier. I think we always welcome any animal lovers to the program. All right. So we had a few, I think we'll get into the questions. We had a few pre-submitted questions, so I thought we'd start there as the comments. There we go. Well, let me say hi first to, hey, Eric, thanks for signing in. Hey, Jen, how are you? Hey, Cassie, you got a beagle puppy? Well, that's exciting. I'll tell you what, Cassie, we'll talk outside of the forum, okay? Hi, Dr. Ulrich. How was your day today, Dr. Ulrich? You had a day off today, I think. I hope you had a good day. Hey, Tasha, happy Thursday. Orion, that's a great name, Cassie. Hey, Lynette. Thanks for tuning in. All is well. I hope all is well with you. You're welcome, Roberta. Thank you. Thank you for tuning in. All right. Hey, Nicole. Hey, Carol. Richard, Lucy, Dr. Ulrich. Thank you, everybody, for tuning in. I think we'll start getting the questions because we're already loading them. I'll do one of the pre-submitted questions and then we'll start, okay? And we'll get through the other few. So Kelly Lynn submitted a question prior to the show. Kelly has a Shishan and that has recurring ear infections. Is there a simple way to prevent them? And then Kelly listed some of the things that have been done, some medications, orals. So this time of year, ear infection, very topical question, right? Because we do see an increase during allergy season of ear infections. When it also coincides also with the increase in heat, increase in humidity. So this time of year, we're seeing a lot of them. Animals that have recurrent ear infections, I think it's important. What you want to do with things like this, recurrent allergies, recurrent skin problems, is you want to get back to, you want to treat them when you see them. You want to get them out of discomfort. You want to treat the secondary bacteria. I just did a talk for a group on this very subject. And, one of my take homes was it's really important when they have recurring issues to get to the root of the problem. Okay. And by root of the problem, I mean, get back, figure out what the triggers are, figure out a lot of times their underlying food sensitivities. So you want to try to figure that out with diet trials. Okay. So I do recommend a lot of times that you switch their foods when they have recurrent ear infections. It's really important that their gastrointestinal system, believe it or not, is in good shape with little inflammation, what they call their gastrointestinal biome, right? That it's balanced, because that will help. 75% of ours and our animals' immune systems are in the gut. So if you build their immune systems, you can help them reduce inflammation, reduce these triggers. And if you can find that this is food linked by doing food trials, you can go a long way. Sometimes we have to do cultures of these ears and find out that there may be a resistant bacteria growing in there, or at least cytologies to look what's growing. So it's something that you have to tackle from a whole body perspective. And they're different for every animal. They're individuals. So there's not one program for each. I hope that helps. Okay. Susan has a question. Susan has a 23-month-old dog who developed environmental allergies at 7 months of age. I've heard that allergies are an indication of a weakened immune system, something we were just talking about, Susan, right? I'm very worried that she will develop immune issues if she receives a rabies booster. What are your thoughts on this, please? Her first rabies vaccine was at 3 months old. Well, one of the things, Susan, one of the things you have to remember that in most places, rabies vaccines are law, okay? Now, I do believe in vaccines, but I do believe in judicious vaccination, meaning there are some vaccines that animals may not need because what you're vaccinating against, they may not be exposed to. Certainly, that's the case with indoor-only cats and animals that live in different regions, dogs, right, that live in different regions. So certainly, you can judiciously vaccinate on many different vaccines. Rabies is a law, okay? And there are things that you can obviously do. You always want to do things to boost the immune system, all right? You can, and that does start with the gastrointestinal system without a doubt. So I think, we talked about, when I talked to this group a few weeks ago, what I was talking about is, if we're that young and you're seeing allergies, I don't know if you've done an allergy test yet. There's a couple different types of allergy tests, right? There's saliva allergy tests, there's serum blood allergy test, and then there's dermal, in the skin allergy tests. We do a lot of serum allergy testing, blood allergy testing at my practice, and it really is a guide. It can give you a guide on what environmental things there are and foods, and then I recommend food trials. I think one of my biggest, one of the biggest things that we're stressing now is having these guys be on the right diet for them, the right protein source, the right combination diet, to boost their gastrointestinal biome, to boost their immune system. So I think that's a good place to start. All right. All right, let's see. All right, Joan has a question. Joan has started obedience class with their year-old rescue chi, Daisy May. Cute name. She's learning a lot, but we are hoping to break her of barking a lot and food protectiveness. Any hints on those two issues? Joan, obedience class is great because it can it can teach them the kind of basic stuff, right? When you're talking about in-home behaviors, barking, food protectiveness, I always recommend having a behaviorist in the house for things like that, because what they can do is they can see what their triggers are, and they can work with you to break them of those triggers. And a lot of times when we are training our companion animals, it really is training ourselves to recognize triggers and to try to remove those and help them. Rescue dogs, a lot of times barking and food protectiveness is not uncommon at all with rescues, right? You think about it, they may be on alert because of what had happened to them in the past. And, you don't know, when they knew their next meal was coming, if they were strays or things like that. So, they're protective. So it's just, time a lot of times will help that. But I do like an in-home behaviorist because I think they can really recognize certain triggers because they're all a little bit different. There's not one reason they do those behaviors. Richard, I live in Orlando and my dogs are constantly licking their paws. Any ideas? Beagle and a Shih Tzu. Richard, these guys lick their paws because of something that's called canine atopy or atopic dermatitis. And what it is they're inhalant allergies. It pollens and things, but the reason why they lick their paws is because when they're out walking around, remember, they're walking in bare feet, right? So what do these pollens do? What do grass pollens, tree pollens, flowers, everything else? They get up into the air and then they settle on the ground. So what happens is these guys walk through it, and then this inhalant allergy becomes a contact allergy. So they lick and chew their feet. One of the ways to mitigate that is I do recommend getting some sensitive wipes or things like that, wiping their feet off when they come back from walks. Okay. And you can even wipe down their coat and wipe their feet. Even me, we're still doing curbside appointments, and so I am outside most of the day, every day, and certainly in the middle of allergy season. See, we had a little bit of a break recently, which is usually this time of year we get it because things dry out. We have had no rain, and we're going to be coming into weeds pretty soon. So you go from grasses and trees to weeds. But I see the pollen settled all over. I can tell when the pollen counts are high because obviously my eyes get itchy. We get runny nose. It's when your body treats allergens, your immune system, okay, is what recognizes allergens. So they recognize them as foreign invaders. Same thing with dogs and cats, right? And so when you get this foreign material, this pollen in your system, your body initiates an immune system response with something called IgE. But what happens is it binds and you release histamine. And histamine inflames certain tissues, and there are target tissues that it inflames. So if it's topical on the skin, all this histamine goes to the skin, you get the immune response, and it causes inflammation, sensitivity, and itching. For people, a lot of times it's eyes and nose. Pets is usually, skin and ears. So I hope that helps. Hey, Ab, how are you? Okay. Georgette has a 14-year-old throwing up white foam when she walks, sometimes with food. She has lost 10 pounds since December. They did all kinds of tests and they show nothing. Have to give her water with a syringe or it comes back up. What can I feed her to put weight on her? So one of the things, Georgette, that they need to determine is the motility of sometimes. So there's different GI distress. All right. So there's vomiting. All right, which is an active event, right? Where you can hear them, their stomach is working, they throw up. There's regurgitating, which is more passive, right? Where they can just spit up. They can spit up foam. They can spit up food. I wonder if she is also spitting up food, if you're noticing it being active or passive, like I just talked about. I think one of the things they have to determine is if you give water, but then it comes right back up. I think they need to investigate if the esophagus has normal motility. You can do that with a little dye study with X-rays. If it's going into the stomach, there's an issue in the stomach. I think if it's important, it doesn't necessarily matter what you give them, but if they're not getting it to where and they're not digesting it, it doesn't really matter. There are a host of very caloric dense foods. We have some recovery foods at the veterinarian, things like that. But the key is you have to be able to get it through the gastrointestinal system, so it is so they're digesting it in absorption, right? Ultimately, an animal that's not getting enough calories is either not taking in enough calories or not absorbing enough calories. And they can be, you could have both going on, or you can have one or the other, but they have to determine that, because ultimately that's very important for how you would help her. Aloha, Diana. All right. Oh, Diana. All right. Diana has a female miniature pit bull who just turned 1. Although she's so young, she is already experiencing joint issues. She has seen 2 vets. Diagnosis with luxating patella on one of her hind limbs and elbow dysplasia in what looks like both forelimbs. She's currently on carprofen, gabapentin, and ethanol. One of the DVMs recommended astaxanthin supplements as well. We haven't started on it. All right, let's see. All right, so, one of the, Diana, it's worth probably going to, if you can, going to an orthopedic and just having them go over, look at the x-rays, go over the different joints. If there's something that may be able to be, that needs intervention now. There's different levels of luxating patella, but luxating patella generally is fairly fixable. All right. You don't always have to do surgery on them, but if they're bad, it especially at a young age, by fixing it. See, joints like congruity, right? Joints like things straight. Joints like joints don't like things rubbing on one another. And so, if the luxating patella is causing the joint to be inflamed and unhappy, it may be worth fixing it at this point, because that's going to slow progression of arthritis over time. And they look at the elbows and see if there's anything else you can do. I think, good. To me, I am a big fan of also part of the program and doing natural joint supplements, right? The classics are, glucosamine, chondroitin, but I prefer to have MSM in there. There are some newer things, hyaluronic acid to help lubricate and reduce inflammation at the joint. There's a host of collagen. There's a host of new things. And actually, we are working, Dr. Bob and I are currently well into working on a joint supplement that we're going to be bringing out next year. So please look for that. I think it's testing wonderfully. Oh, hey, Melissa, thanks for joining in. All right, Patty, hi. Hi, Patty. My dog has bad breath. What can I do? Common problem, Patty, something I get asked about a lot. I think what I would tell you is that all bad breath in dogs doesn't come from the same place, okay? So good to have your veterinarian go over your guy or girl. Sometimes it could be a dental issue, all right? These guys get tartar like people do, tartar on their teeth. It can also be a stomach issue, digestive issues. So they're, if they are, if they have some gastric reflux, things like that, that can cause breath things. So it's good to have a veterinarian check, because you'd approach it differently. Cassie, you know what I'll have you do is I'll have Eric give you my Earth Animal email, and you can email me there, and I'll talk to you. I'll send you an email off the air. All right. All right, Britt. Recurring ear infections has been a struggle for our 13 years with our girl, thanks to seasonal allergies. It's definitely about being diligent. It is, Britt. I mean, that's a good point. It is about it. You really have to. It definitely takes some effort, and it takes, this is one of the situations I tell people about all the time. It's one of the situations that it really takes teamwork with the pet parent and the veterinarian. And and just talking and making a game plan and sticking to it. And, some things work, some things don't, and you could check things off. So it really is being hypervigilant and just initially setting a goal, if it's food-based, doing food trials, and just, it takes a lot of communication. And one of the things that I will tell you, that I think it's important that sometimes people forget, and sometimes even when I'm speaking, when I'm talking to people about food allergies, I forget to mention it. And I really, really now have it just burned into my brain that every time I talk about food allergies, I talk about it. So I'm going to do it here. Remember, if you're feeding your dog what you would call a novel protein diet, you're doing a food trial, they're on an alternative protein and limited ingredient diet. Remember that if you give them any sort of treats or anything else, they have to match what you're giving in the food. So you can't be doing a food trial and have a variety of different proteins and things going into them. So just as an example, if you're feeding a duck-based food, you can't then give a beef or venison-based treat, because now you've introduced, and if it's not working, you don't know which one it is, what the culprit is. You have to be very streamlined in your approach and very selective. So I think that's always important, because some people, forget about it. So it's good to be back, Nora. I hope things are well. Hey, Suzanne, how are you? All right. All right, Lucy. Hi, doctor. I have a 10-year-old toy fox terrier. She was diagnosed with cardiomyopathy a year ago. She's now in severe stage, and the vet I am seeing now just put her on beta blockers. I am so distraught by this whole thing, not sure what else I can do. I think, well, Lucy, one of the things I do recommend, if it is an option, there are several different supplements. There's also, if at all possible, to consult a cardiologist, because, and I don't know if you had a cardiologist do an echocardiogram, but if you can at all do that, because you can really pinpoint exactly where they are cardiac wise, and a lot of times they're doing wonders with more and more different med combinations, so it might be worth seeking that out. Tiffany, hi, my pup is a Shih Tzu and she's 11. She was diagnosed with degenerative mitral valve heart disease with high blood pressure. What holistic might be able to prevent this from progressing? She also has an interdigital furunculosis. We've done the 2 months of antibiotics, and vet is saying surgery is an option. Is there anything else that can get that lump inside her paw to resolve? All right, let's talk. We'll talk paw first, okay, and then the mitral valve disease. What happens with this interdigital, so, maybe allergy based, but these interdigital cysts and then ultimately furunculosis, you get scarring, is they can get scarring where they kind of are chronically irritated and infected, Tiffany. And what will happen is then it lays down scar. So you can get this kind of constant thickened kind of ball area in, between those toes. And, sometimes if they're that bad, surgical removal is the option. I'm not sure in this case. Obviously, I can't tell just, kind of in this forum. But if it's truly kind of fibrosed and scarred in, a lot of times it's difficult to kind of to step back from that, because the body has already laid down all that scar tissue. As far as mitral valve disease, again, I want to tell you, I'm a firm believer in, if possible, getting these guys to have an echocardiogram by, a board certified either internal medicine person or a cardiologist, because it really gives you a host of information on stage of the disease, thickening, how bad the the jet is, the regurg that's coming back through the valve. And it can really give you, because again, like, we were talking a little earlier, all these guys are not the same. And they, even, so not two mitral valve diseases are exactly the same generally. And when you throw in hypertension, because a lot of times these things can start to become, can start to go a little bit hand in hand. I am a big fan of an integrative approach. I think, but you want to know exactly what you're doing from a med standpoint before you start doing different things holistically. Like I said, in cardiac stuff, I truly am a big fan of mixing holistic and conventional and doing it integrative, right? All right, Sue, does a probiotic help with allergies? If so, what is a good probiotic? So getting back to what we said a little bit earlier, Sue, I am a big believer in gastrointestinal health, and with probiotics can absolutely be a part of that. Again, Dr. Bob and I are working on right now, a gastrointestinal supplement that has pre and probiotics in it, and other things that help with digestion, because again, a healthy gut, healthy GI system with less inflammation, it enables animals and people to clear things through their body better, right? And to reduce inflammation really helps all body systems. So yes, the answer to that is yes. And there are some good ones out there. There's several good ones. It's always good to go, you can easily get that. I do, something like this rather is great to go to your local independent pet retail store and talk to someone in the know about it and say, this is what we have going on. I would like to improve the gut health of my guy. So can you recommend a probiotic? Dean, how bad are people snacks for my dachshunds? So I can truly, I always tell my clients and friends of mine know this, that I'm an open book. Okay. When I talk to clients all the time about, the hazards of giving people food to animals, I do think it is not ideal for a number of different reasons, especially depending on what snacks, right? But I also tell people, I am the person that before I went to vet school used to share a popsicle with my bulldog, which I then found out was not ideal, okay, remotely. And so definitely not good. No sugar's good for the dog. But I learned when I went to vet school, these things are not good. And it really is important that you limit that. It does foster, obviously besides the behavioral aspect, it's calories that they get that a lot of times are on top of what their normal caloric intake is for the day. So it can lead to weight gain. There's also a bunch of things in people snacks that are not ideal for them, and things that you wouldn't even think about necessarily. That some things may contain some sort of onion product, which is not good for animals, right? You have to be very careful with, sugar substitutes, because they can make them extremely sick and even kill them, things like xylitol. So it's really important. I really stress to people, it's not ideal to do. All right, let's see. Yeah, Jennifer, I know you're talking about CBD treats and Sammy and elevated ALP. It's interesting. I've actually on a personal note, had a dog that was only on a CBD supplement and actually had an elevated APO that temporarily had come down. So I don't know. I'll have to look at that study. I'll have to look at that study by the AVMA. I'll look it up and read it, and I'll talk to you about it. All right. Barbara, I'm reading so much about kibble and processed foods. Yeah, I mean, when you talk about foods, and people ask me obviously about diet all the time, and you have these categories. You have raw, right? You have kind of hybrids, okay? That is like a wisdom from Earth Animal. We'll talk about that, and then you have dry, and dry food. And I always say that there's not one food that I recommend for every single animal, because no two animals are the same. They're all individuals. No two animals of the same species are the same. No two pugs are the same. No two bulldogs. So different animals do. I have animals that will do better on some kibble. But the thing about kibble is, even kibble is a food that is cooked at very high temperatures and then extruded, and you can lose a lot of nutrients doing that, right? That's the basis of raw, right? And then you have a food which I think obviously is remarkable, like Earth Animals, the wisdom, that is cooked at a very low temperature, gently air dried, just to a kill step, so you can eliminate bacteria. So it's really like a raw that feeds like a dry, because it's stable at room temperature. So it retains all that nutrients. So yeah, there is a lot of kibble out there I do not recommend, and there is something to be said for how it's produced and processed. Darlene, how can I keep my dog from pulling on leash? I want to take her to the beach and let her run without running after her. Yeah. So, Darlene, it's when you're leash training a dog, right? There are a few now. Some, it's a lot of repetition and walking a bit, and sometimes sitting and teaching them not to pull. There are training tools for those, like with things like a gentle leader, right? Gentle leaders go across their nose, so when they pull, it pulls their nose down. I've seen those work as well. But it really, like with my guys, I have 2 rescues, and it took a very long time to train them and keep them from pulling, and it just takes repetition. Walking them on the same side of your body, going and stopping. Even if they're food motivated, this is a great time for training them with treats. Okay. Hey, P-Pat. We have a big birthday coming up. So yeah, it's just repetition, Darlene, and really trying it. But if you're having a problem, try that. Try one of those gentle leaders. I've used those in the past. They're a little tricky. You should have someone teach you how to put it on, because it can be a little tricky to learn. But once you know how to do it, it can be very effective. And it's only a thin little piece of nylon that goes over. It's not a muzzle. It's not anything like that. It's just a thin little piece. But when they pull, it pulls their nose down, so it prevents them from pulling forward. And I like that as a go-to rather than some of the other collars that pinch them or things like that. Okay. Britt, we have recently been informed that a dog being diagnosed with blastose, a fungal blastomycosis, from our go-to camping hiking area. Is there anything we can do to prevent a problem if we're spending time in the area? That's a great question, Britt. The problem is, if you have those spores and things that are in the soil, and your dog is one of those dogs that has their nose down there, it's definitely a risk. It's definitely a risk to go to that area, because they can reinfect themselves. And, obviously these guys just are so smell driven and nose driven, and some more than others, right? Some breeds more than others, that they tend to have their nose to the ground all the time. So prevention wise, I think that'd be tough, other than not being in that area. Right. All right. Tasha, my friend has noticed that when she travels, her cat has been getting UTIs. Can stress contribute to UTIs, or could the timing just be a coincidence? Any insight? Hey, Tasha, I think stress absolutely can contribute to a lot of syndromes, disease processes. It lowers the immune system, right? I would also say in this case that during travel, cats are going to obviously urinate less, right? So no matter what kind of travel it is, that they may be they're in, whether they're in a plane or a car, they're going to go distances without having access to the litter box necessarily. Or if they do, if they're set up, if they're set up in a car where they do have a box, a lot of them won't go in it because they're stressed and that's not their normal environment. Also, when you get to where you're going, you're setting up a new situation. Cats really like, kind of their own setup and changing locations, litter, boxes. You can really throw them off. So I think this probably is a combination of stress and urine retention, that she may not urinate as much, and the more that they retain urine, the more that they have a tendency to get those. I hope that helps. All right, let's see. Darlene, what else could be, causing a cloudy eye, having white film coming out? Vet has been giving eye drops, says that's all we could do for now, but not helping. So, Darlene, the brachycephalic dogs, bulldogs, pugs, Boston Terriers, kind of the gamut, the flat-nosed dogs, who I love. They can be predisposed to eye things, eye stuff, right? Anywhere from dry eye to where they don't produce enough tears, to glaucoma, to just more. They're definitely more prone to conjunctivitis because their eyes sit further out, kind of into the world, because of how their skulls are made, are formed. So I would, if you're not seeing a difference, I think probably going to an ophthalmologist where they can do pressures, make sure we don't have increased pressures, make sure that they have done there's cloudiness to the outside of the eye, which is the cornea. And then there's cloudiness that comes from within, and they're two different things and indications of two different types of problems. If it's on the outside of the eye, make sure that they're doing staining to make sure there's no corneal ulceration on that eye, and also tear tests to make sure that they're producing enough tears. But part of a kind of a overall ophtho eye exam is, and something like that, is checking pressures, making sure the pressures aren't high, checking tear production, and checking and staining and making sure there is no scratch or ulceration on the eye. Yeah, Richard, I think, it's about, one of the things with the wipes is it's about, on the feet, it's about just, again, doing it repetitively, right? And we all can get out, listen, we're all busy, and you can get out of a routine, right? But I will tell you that doing the wipes kind of chronically will help, okay? All right, Monica, I have a 60-pound golden doodle who burps quite a lot after eating, despite raised food bowl and feeding smaller meals. He still burps a lot. We'll settle until the burp comes out. Any suggestions? Monica, sometimes too, you're doing the raised food bowl, you're doing those things, and feeding smaller meals. Sometimes slowing them down is a good thing. Getting one of those special bowls where they have to pick around things, so they slow down, so they're not gulping it down as fast. Making the food, whatever you're feeding, adding some water to it sometimes to make it a little more dense. But slowing down the eating is something that can help. Shelly, you have a German Shepherd, 12 years old. Advice on eye infections. You sure she has one? I'm very worried. What you need to do, Shelly, is go to the veterinarian. Okay, something like that could be as simple as pink eye. You have no idea how many pink eyes I've seen in the last month, how many conjunctivitis. A lot of them are allergy based. There's a lot of pollen in the air, and then they get a secondary bacterial infection. And it certainly, Shelley, could be just as simple as that, but a veterinarian has to look at that. Okay. And it may be as simple as eye drops or eye ointment. See. Yeah, Jen, I have your question already, actually, and was going to get to it at some point through the day, but we'll do it now. So you have a 13-year-old Aussie with elevated liver enzyme all of a sudden in March. We've tried meds, but some levels went down, some went up. I did research. It says a low copper diet and high zinc. I've been cooking for him, trying to incorporate raw foods. Anything else I can do at home? Should I be giving a probiotic? Well, probiotic, Jen, is never going to hurt. Did they do so? If I see elevated, all of a sudden elevated liver enzymes in any dog, but a mature dog, I usually like to do a couple things. One is I do like to get X-rays to be able to look. You can't palpate or feel the entire liver, sometimes not at all, because it's up under the rib cage. So it is a good idea to get at least the basis X-rays to see if you see any abnormalities with the liver. Okay. Oh, you added to this. Sorry, that's what I had from before. Abdominal scan didn't show any cancer, but gallbladder slug. Tried ursodiol, milk thistle. Some came down. ALP continues to rise. When they did the abdominal scan, I assume you probably mean ultrasound, Jen. Did they look at the adrenal glands and make any comments? Is it possible we could have some other concurrent things going on here? Sometimes Cushing's disease, hyperadrenocorticism, an increase in cortisol secreted by the adrenal glands can cause an ALP to rise. Okay. Copper storage is something I get that. I get where you're going with that. But one of the things is with the ursodiol is it helps the gallbladder empty better, right? Milk thistle is a great supplement for liver inflammation, a natural supplement to help with liver inflammation. Denamarin, there's a supplement that does SAMe and milk thistle together that a lot of people use as a combination. So that's something to try. As long as, it's important when they do that I assume I scan, you said, you mean ultrasound, how's the rest of the liver? Did the rest of the liver tissue look congruent, and normal? And it is also probably good to follow up with another scan after you've been on the medications to see if the gallbladder is more empty and flowing better. All right. All right, Gina, what is the best thing to do for a dog that's been skunked? Lots of this going around. Several reports on social media of people using a certain enzyme floor cleaner directly on a dog. Absolutely not. You do not want to use any sort of chemicals or cleaners on your companion animals ever. Well, Gina, my dogs were skunked, a month ago in our backyard. And it's, this time of year, very common. The skunks are very active. There are a couple of shampoos that you can get at your local pet stores that actually do a pretty good job. The thing is that you have to understand. One is that you're not going to completely take the smell away. It's impossible. The other thing that I always recommend is you can bathe them once or twice right when it happens. You want to get those oils and that awful smell off of them. And a lot of times it's still sitting on their coat. So if you wash it away, it's not going to soak in. But repeated baths don't help. getting them wet again kicks up the smell. As a matter of fact, so we had some rain, and it was pretty humid and some rain last night. And we actually, my dog walked past me, and I smelled it just a little bit still on her, my dog Sadie. So it's it can be around for a while. One of the things when our dogs, like most people, if you're not directly with them when it happens, or they're in your backyard, what happened with us is then you go to let them in, they get by you into the house, and then you get hit with that smell right away, but they're already running the house, so now the house smells like it. I've done for the house, sometimes I've simmered some vinegar on the stove. That can help because it kind of does the acid base thing to remove it. But I get them, you don't want them running anywhere, touching your furniture, running. You want to get them right. If you ideally can if you catch them before they come in and you can wash them outside, that's the most ideal thing, because at least you can get the bulk off of them. Remember to wear gloves and anything on you that you can, because when you come in contact, the more you come in contact with it, the more you're going to smell. But some of those skunk shampoos actually do a good job at just getting it off of them. There is a kind of homemade thing that people do with Dawn and hydrogen peroxide, but I also have had people try that at home, and then they've given their dogs highlights over their entire. They've given them, I've had some people with like chocolate labs that then had complete white tips through the whole entire dog. So I do think it's worth it if it's happened to you. It is so worth it to have a bottle of that shampoo in the house. If you never have to use it, great. It's just there when you need it. Alana, you have an 11-month-old kitten who is experiencing panting, specifically when it is hot and when she runs around inside, she also pants. I assume I should be looking at asthma diagnosis. Well, certainly asthma is something we see in cats. Yes, I think it's always very important to make sure that a veterinarian goes over the kitten, make sure, cardiac wise, they're doing okay. All right. There's some really kind of cool, some cardiac disease in cats can be a little hidden. Cats with some cardiomyopathies don't necessarily have murmurs and things. There's even some enzymes you can do in blood that can kind of be a screening test for it. I just think it's important, if they're doing that, to make sure, all right, that everything else, chest wise and cardiac wise, they're fine. You can't always see indications of asthma on a chest x-ray. Sometimes you can, sometimes the lungs will be hyperinflated, but I definitely a situation where if you're seeing that, I would recommend the veterinarian does it, kind of complete physical and, maybe a little blood and a chest x-ray. All right. To start. Let's see. Linda, can I give a 14-year-old mini poodle chicken along with his dog food? Not that, Linda, not that again, like we're talking about with adding food, would it really hurt? No, I wouldn't say that. Is it necessary though? I think you have to be careful about doctoring animals' foods when you give it to them, because one, I think especially with some of the smaller guys, it really brings it can really foster pickiness. Okay. And they just, remember, most foods that are developed are developed to give them all the nutrition they need within that food. So if you add to it, oftentimes you're adding calories, and you may be throwing off kind of what you want to do with the ratios of protein to carbohydrates to fats. Okay. So it's probably not necessary. Natasha, my dog did great all summer with allergies. I will tell you then your dog was, we had, and I don't know where you are, at what part of the country you're in, but we had a really tough allergy season here on the East Coast, where we are in Fairfield County. It was really tough. And amazingly, it's been dry, but also pretty tough. So I'm glad for that. But now all of a sudden he's scratching his skin more. No changes in food, but he does have grass and plant allergies. What I would say, Natasha, is that that's clearly an indication that there's a bloom wherever you are going on. There's a bloom that is part of his allergy profile. Okay. And because if nothing else has changed, like I was saying before, we're, because I'm outside and we're doing curbside a lot, I can tell directly. My allergies have gotten worse over time, and I'm doing a lot of things to help naturally to help that. I've found some good. I take quercetin, which I think it's a good natural antihistaminic, anti-inflammatory, and it does help me actually. But I can tell when I'm going to see more animals itching just by what I feel like when I'm outside in the morning. I know that there's a different bloom going on. It's so when I'm stuffy and itchy eyes and everything, I know that we're going to get more calls inevitably. So that's probably what's going on. You're welcome, Lucy. Hey, Debbie. So, Linda, is a Lyme vaccine safe? Well, okay, there are different companies, different Lyme vaccines. There are good Lyme vaccines and safe Lyme vaccines out there. Again, like we talked about before, I think what you need to do is you need to assess risk with any of these vaccines. What area you live in, is it a high, obviously around here. We are basically, they named Lyme disease after a town in Connecticut. So we are in a highly endemic area for tick-borne disease. There's a lot of ticks around here. There are certain vaccines that I consider better than others. There are some recombinant vaccines, not the older vaccines that were out several years ago. I was not a fan of. I think they've come a long way. So I think you need to have a conversation with your veterinarian about risk for tick-borne disease and what your specific dogs, what if they have any pre-existing conditions, immune-wise, everything else. So I think again, this is a conversation always to have with your veterinarian on an individual basis on risk-reward and what your specific animal's needs are. All right. Sheila, my dog Yorkie jumped off the couch, hurt her leg. Vet said not her hip. Can I wrap her leg myself and wait to see if it will heal before surgery? Thanks. Well, first of all, I wouldn't recommend you wrapping the leg because oftentimes you can do it too tight or things if you're not. And Yorkies are very hard to put any sort of wrap because they have smaller legs and they're hard to stay on. And you might have a tendency of putting it on too tightly. And also, if you don't know exactly where the issue is, you may not be helping but hurting by wrapping it. A lot of times this injury, if it's not a hip, is a knee, either a kneecap, a luxating patella, like we talked about earlier, or a cruciate ligament injury. Probably good to get an orthopedic to feel that knee and that leg, and then see if there's something they can do with rest and supplements and anti-inflammatories before. But I would not wrap it. So Gina, raw food diets seem to be very expensive, but I believe in them. Is it okay to just feed some fresh raw meat in my dog's kibble for a balanced meal? On paper that might look okay, Gina, but actually it's not okay for several different reasons. But one, just fresh raw meat, obviously, while protein is not balanced, and adding it to an already what they would consider balanced diet is just adding in more protein. So it doesn't give you the benefit of raw food. And you're also taking fresh meat, and you have to be very careful where you get that from with bacteria and everything else, and adding it into a processed. So you're kind of defeating the perfect purpose. And I understand that raw food diets seem expensive. And they're expensive for a reason, obviously, because they're, the process of they're generally very high grade foods, and obviously the ingredients are expensive, and how they're processed are expensive, whether they're frozen or freeze dried, or so. Generally, you're not matching a raw by feeding raw meat and a kibble. What I would do is, if you really want to look into raw, compare foods, compare how they feed. Some foods are more calorie dense than others, so you have to feed less of them. Wisdom, for instance, is a very caloric rich food. So the benefit of that is they feed less of it. You don't have to feed as much as other diets to achieve the same thing, so you use less of it. All right. All right, we've got time for one or two more here. Sorry, guys, that I don't get, that I can't get to everybody's questions here. We have a lot of questions. This forum is great, and we just have the hour to do it. So the people that I did not get to, I apologize. Tune in next time. We'll try I get to as many. Hey, Morgan, thanks for tuning in. I'll try to get to as many as I can. All right, let's see. All right, we'll see if we can get to one more here. Maybe we can squeeze two. Nicole's a question. Hi, Dr. Kris. Charlie turned 13 this week for the first time ever. His stomach seems sensitive, and over the last few weeks, there have been some days where he vomited bile 1 to 2 times per day, morning and night. Should I be worried or just feed him earlier? Well, Nicole, sometimes these guys can get. When I'm talking to clients about this, I always say, you picture sometimes where if you eat an early dinner or you skip dinner, and if you go a long period without eating, the longest period generally is from dinner till morning for these guys, because they may eat 5 or 6 and then maybe they eat 7 or 8 in the morning. They can get sour stomach. So it's certainly possible that's what it is. Maybe sometimes. So I'll say sometimes you can give them a snack, maybe a little snack at certain points during the day, kind of in between, something to put in their stomach. But this is new, right? So if it does continue or worsen, I think it's worth having, taking a peek just to make sure that they're okay. But it could just be that. It could just be that, an empty, because the bile vomiting means their stomach is empty. You're not seeing any food in it. So it may just be some, an upset stomach. But again, if you're giving little snacks and you're kind of adjusting the feeding a little bit, and it continues, definitely should be checked. All right. Okay, just last quick one. Gina, if I know my dog has an orthopedic issue, can I bypass my regular vet and find a specialist myself to save costs? Gina, you can. I don't believe, around here we have orthopedics at some of the referral centers that you can make a direct appointment with. I don't think it's different in most other places that you would need like a referral like we do as people. All right. So certainly if you're seeing something like that and you want a specialist, an orthopedic specialist to look at it, I would encourage you to do so. All right. All right, everybody. It's amazing how fast this hour goes. Thank you, everybody, for tuning in. I really appreciate it. Yeah, Denise, I'm sorry. I'm sorry that this was your first time. I didn't get to your question. I'm sorry. Please tune in next time. You know what, Denise? I'll tell you what. Pre-submit your question for our next show. All right. Pre-submit it, and I will answer it first. Okay. Um, I'm sorry. Thank you for joining it. It just as you see, Denise, I have a lot of questions, and I can't quite get to all of them within the hour. So I apologize. Thank you, everybody, for joining again. Again, wonderful cooperation. I can't thank you enough for tuning in. If you like the show, please like it and share it with your friends. And I will see everybody soon. Thank you so much for tuning in.